Hi everyone, welcome to today's YouTube video. So today we're going to be discussing some chronic diseases that might be related to sleep and adolescent sleep deprivation, and how these can maybe accumulate into long-term conditions or illnesses that can affect people for long periods of time. So the first thing that we would like to talk about is the correlation with type 2 diabetes. And so what recent studies have actually found is that sleep duration and quality has become a predictor of the levels of hemoglobin A1C. And hemoglobin A1C is an important biomarker for blood sugar control. And so basically, people who have insufficient sleep have been linked to developing type 2 diabetes, seen through the progressive changes in their hemoglobin A1C levels. The second chronic disease that, or not necessarily chronic, but disease that could develop from lack of sleep is cardiovascular disease. And so there have been lots of studies showing that sleep apnea, which is a very common sleep condition, has correlated risks with cardiovascular disease. And according to the CDC, hypertension, stroke, coronary artery disease, and irregular heartbeats have all been found to be more common among the people with these disordered sleep conditions than people without sleep abnormalities. And so sleep apnea is also correlated with the hardening of arteries, and it could be a actually important predictor for cardiovascular disease. And so the CDC has found quite numerous connections between sleep deprivation and cardiovascular disease and sleep apnea. The next thing we would like to discuss is obesity. And so this one's very interesting as to how it is correlated to a lack of sleep. But obesity has been associated with short sleep duration, and it's especially pronounced in children because of the importance that sleep has for their brain development. And so during sleep deprivation, what can happen is the lack of sleep can cause impaired development of the hypothalamus. And the hypothalamus in the brain region, as you can see right here, is very important for controlling energy expenditure and appetite urges. And so when these areas of the brain aren't developed as properly as they should, this has been linked to greater chances of perhaps obesity. And so that is why, especially in children where the hypothalamus is still under strong development, there have been some correlations with sleep deprivation and obesity, and it's something that can persist well into young adulthood until the hypothalamus is fully matured and developed. And then the next one we would like to discuss is depression. And so there have been numerous studies that have looked into a significant association between sleep deprivation and depressive symptoms. And so the emerging depressive symptoms among many is often attributed to this acute lack of sleep that could occur, and it is like a two-way cycle that one thing leads to another, and they both build on each other until it becomes more and more disastrous. And so lack of sleep has been associated with depression. And so the last condition that we want to sort of describe is addiction. And so how could this be related to sleep deprivation? Well, similar to obesity, this is more of in the brain development aspect. So a lack of sleep has been known, especially in adolescents, to sort of halt or subdue the development of the prefrontal cortex. And the prefrontal cortex is a region of the brain that is super important for critical thinking skills and decision making, and very important for assessing the risks and the benefits or the outcomes of a situation. And so in this decision making, if the prefrontal cortex is not necessarily fully developed, people who may be sleep deprived may be prone to being more susceptible to going down the paths of drugs or alcohol and various other addictive substances. And so there have been studies that have shown this correlation between a lack of sleep and drugs and alcohol addictions. And that is because of this second critical period that occurs for teenagers. During this period is basically where the prefrontal cortex fully develops. And so that's why it has become so critical to have maximum sleep. And people might have heard that teenagers take more risks. It's because the prefrontal cortex hasn't been fully developed. And so sleep deprivation is going to kind of mess with that development of the prefrontal cortex and is more likely for some people to lead to poor decision making. And so that's all we have for today's video. We're excited. We hope to see you in the next video. Thank you.